Thank you so much. Good afternoon and good morning to those of you on the West Coast, and welcome everyone to this learning session on financing care systems and policies. I'm thrilled to introduce myself as the new Executive Director of the Care for All with Respect and Equity Fund, or the CARE Fund. It's a collaborative fund supporting movement building for a robust care infrastructure. You know, the diversity of foundations that we have represented in the virtual room today truly represent the goal of the CARE Fund to build movement for care across the life cycle and across generations. You come from foundations focused on issues ranging from birth equity to early childhood education to healthy aging, from workers' rights to disability rights to women's rights, from improving the lives of family caregivers to improving the jobs of care professionals. Now, to build movement, we need to get to know each other. So we're not doing this in webinar format. We're all on the call, and we are going to start with a chance for you to get to know one other person on the call. We're going to break you up in groups of 2 for quick introductions. And in that, you will have 2 minutes each to share your name, your foundation, your pronouns, and to answer this question. If you were to dedicate this meeting to someone you've cared for or who cared for you, who would that be and why? If you were to dedicate this meeting to someone you've cared for or who cared for you, who would that be and why? So now you can break us up into the groups of 2. Thank you. Great. Welcome back, everyone. Oh, that was an emotional discussion for me, and I'm imagining it was for all of you too. To open today's session, I'm glad to be joined by both a funder and grantee partner to give you a very brief overview of the CARE Fund. We launched the fund in 2021 to seize the moment of unprecedented policymaker and media attention to care as essential for thriving families and a thriving, equitable economy. Care is at the crux of legacies of oppression by gender, race, age, ability, immigration status, and family structure. This has led our society and economy to devalue both those who give and those who receive care. We've been inspired by activists who are bringing together care consumers and care workers to mobilize for government investment to ensure that care is accessible, affordable, and high quality, and that essential care workers have living wage, dignified jobs. Erin Currier is co-chair of the CARE Fund and represents one of our first partners, the Kellogg Foundation. Erin, could you share a bit about what inspired Kellogg to join the CARE Fund?
Yes, thank you, Anna, and hello, everyone. It's so nice to be with you today. My name is Erin Currier. I'm a senior program officer at the W.K. Kellogg Foundation, and I co-lead our national team there. For those of you who don't know, the Kellogg Foundation is dedicated to the health and well-being of children, but we recognize that children live in families and families live in communities. And so our programmatic focus is on the whole in 3 key areas: early childhood education, health equity, including maternal and child health, and family economic security. And all of our work is grounded in our organizational DNA of racial equity, community engagement, and leadership development. And we joined the CARE Fund, I think for the reasons that Anna just mentioned, in particular because we believe in the necessity of a strong and sustainable publicly supported care infrastructure. You know, we have known for a long time that our nation's care infrastructure is a house of cards, but the pandemic just really laid bare that fact and made it impossible to ignore. Women and women of color especially just fell out of the labor force in droves, in large part because they did not have access to childcare or early education systems the spread of COVID was exacerbated by a lack of paid leave. The workers who we consider essential to the functioning of our economy and the care of our families did not have the wages or flexibility to care for their own loved ones. The sheer devaluing of care was completely apparent. We also joined because we recognize that working in collaboration with other philanthropic institutions is absolutely critical if we want to build more movement, build power, and actually have the transformational change for children and families that we're seeking. You know, we often in philanthropy celebrate when our grantees come together across sectors, across advocacy issues, when they see the intersectionality of their work and come together to build power in coalitions. And this is philanthropy's equivalent of that. This is such a diverse group of funders who come to this space and come to this issue for lots of different reasons, but we're doing it, we are leading by following. We are following the field and recognizing the power of coming together, seeing the intersections, and really working to drive resources to the communities who need it in order to create this sustainable change. So it has been a personal, just incredible opportunity for me, but also for the foundation to be a part of this group has been amazing. And I'm so happy to be here. Thank you.
Thank you so much, Erin. You know, we hit the ground running at the Care Fund last year and provided rapid response funding to coalitions, movement networks, and advocates working across paid leave, childcare, long-term services and supports, disability rights, and aging rights. They were all working to mobilize constituents around the opportunity for unprecedented federal investments in care. And key among those grantees is, of course, Family Values at Work, a network active in over half of the states around the country who are working to make sure that the voices of those most impacted, especially low-income women of color, are heard in communities, state houses, and in Washington, D.C. So now I'm really thrilled to turn to Sade Mumsami, Family Values at Work's Deputy Director, to hear your take on the Care Fund and how the support has impacted Family Values at Work.
Good afternoon, everyone. Thank you for having me. It's exciting to see so many friends and allies. As Anna mentioned, Family Values Family Values at Work is a network of grassroots and advocacy organizations. We fight and win on changing economic justice policies around paid leave and childcare through centering the power of women of color. The Care Fund invested in us in a really critical moment when we needed the most support as we've been wavering through the pandemic. The additional funding that we received from the Care Fund helped us in several ways. It helped us to increase our staff in order to offer more technical assistance. We've been small and scrappy for a long time and have officially grown our staff over the past 20 years through investments from many of you all. It helped us to grow our staff, and most importantly, it helped us to invest deeper in our state network to meet the capacity needs, growing our pool of grants to states to over $4 million within the past year, to really focus on the capacity needs needed. Additionally, the emergency funding during the federal advocacy moment allowed us to dig deeper into digital organizing, which was really key during this moment when so many people went virtual. This is still a critical area for us to grow in this moment through all of the folks that have been engaged. Lastly, as we continue to fight for paid leave and childcare, really being able to drum up national rallies and multiple rapid response campaigns. During the first months of the pandemic, we were holding rapid response calls nightly with our state networks to really be able to translate what was happening on the federal level and how quickly it could come down to the states. Additionally, in 2021, we invested directly into federal funding for our state partners and our state advocates. This has resulted in all of our state coalitions being able to not just focus on the state level, but to focus on the federal fight, which capacity and engagement is tough when you have one organizer working on state and federal level. And we're excited to say that through that investment, we've really been able to get all of our state coalitions to be involved in the federal fight. These investments from the CARE Fund were key to really mobilize within the pandemic and to mobilize both on the federal and state and level. Currently, as we continue to figure out how we will support our state network, our goal is to secure national care infrastructure policies that include paid sick days and safe days, paid family and medical leave, as well as affordable childcare. In order to accomplish this, we have to continue a mix of sustained deep investments in coalitions in this moment, technical assistance, pair cohort groups, and we've been happy to be able to provide that assistance ourselves, but also with other CARE Fund grantees and to strategize with other CARE Fund grantees on how we can best mobilize our bases in connection together. In this time, we really believe that it's a critical moment to invest in states that we know, and as we've seen all of the latest news, are facing critical attacks, and we have to support them in strong movement building and policy change. For me, that happens in 5 different ways, from building organizing capacity to ensure that we're getting to the base that we need to, and that we're engaging so many people that we were able to engage in with digitally. Deep investments are also needed at this time on the state level in terms of coalition building to ensure grassroots organizers are not only at the table, but leading the table to ensure policy creation and serves the most impacted. Also, robust state pilots and investing in state pilots that we can really lift up to the federal level and bring up so we can pilot and share those. And states are just doing amazing work. Happy to see New Mexico on here and so much dope things that are happening. Also, we have to continue to build the narrative and culture change. I think before we were talking a lot about care infrastructure on the national level, and so many of the states are really investing in care coalitions and how to really move the care infrastructure. My last thing is we also have to support leaders in this movement right now. The burnout and turnover, the healing that has to be done on the ground coming into the pandemic has to hit our leaders. We're seeing some of the highest turnover across both state and national organizations, and really supporting leaders in the most robust and holistic ways and innovative ways that we can think of. So these next few years are going to be critical, and we need to re-engage and support states more than ever. And we've been honored to really work with so many powerful leaders and so many powerful funders across this. So we appreciate it. I'm excited for this conversation. So thank you for having us.
Thank you so much, Sade. Thank you very much. So moving forward, the CARE Fund has 4 strategic priorities. We're going to invest in equitable implementation, movement and power building, narrative and culture change, and policy innovations at the local, state, and federal levels on both program design and how to raise revenue and structure the financing of care systems. And that's where today's session comes in. We know that public investments in care policies and systems will promote family economic stability and mobility across generations, create millions of good jobs, and ensure that family caregivers, mostly women, can contribute to their families and our economy's well-being. Understanding how best to structure public financing of care systems and policies is a priority learning edge for us at the CARE Fund. Before we start funding in this area, we want to learn about options and models, the equity implications of different revenue strategies, and how financing models can contribute to building base and power. So we're not coming to you today to present lessons we have learned. Rather, we are inviting you to join us on our learning journey and engage together with national, state, and local experts. We believe that ultimately massive federal funding is needed to build a robust care infrastructure. And at the same time, we know that some of the most innovative experimentation and mobilization is happening at the state and local level. We have an incredible lineup this afternoon, starting with a panel of national experts and then breaking into small groups. We urge you to stay for the small groups where you will be hearing from local and state leaders with experience on the ground, mobilizing a base for care funding and implementing programs. We know also that our discussion today will only scratch the surface and doesn't even get to some very important issues like private financing. So we'll also ask you at the end of the session if you'd like to continue with us on this learning journey. Finally, it takes a village to organize a session like this. And I want to sincerely thank, there's so many people to thank, but especially thank Allison Cook and Julie Cashin. I wonder if you could put their spotlight their faces, to have brought their brilliance to designing and organizing today's meeting. I'd also like to thank the Ford Foundation for virtually hosting us, and especially Anthony Scarano of the Future of Workers team and Catherine Ardila of the AV team. And of course, I want to thank all the Care Funds grantee and funder partners. So now, thank you, Allison and Julie. And now I am very pleased to turn the table over to Allison to moderate our first panel. Thank you so much.
Hi, everyone. Thanks for joining. Our first panel is going to be on financing models and equity. We are joined by an amazing group of panelists. I'm not going to do a full bio for each of them. We will put it into the chat, but we will be joined by Indi Dutta Gupta, the President and Executive Director at the Center for Law and Social Policy, CLASP, Mark Cohen, the Co-Director of the Leading Age LTSS Center at UMass Boston, and the Research Director for the Center for Consumer Engagement in Health Innovation at Community Catalyst. That was quite a mouthful. S.J. Glynn, who's the Senior Advisor in the Women's Bureau at the U.S. Department of Labor. And last but definitely not least, Marika Cox-Mitchell, who is the Senior Director of Early Childhood at the Bainum Family Foundation. What we will do is first have each of our panelists, starting with Indi, do a very brief presentation, and then we'll have a couple minutes for only clarifying questions. We'll have the panelists discuss a couple of questions and a couple minutes at the end for Q&A. I do encourage everyone to put questions in the chat throughout this panel. If we don't have a chance for the panelists to get to it during this session, we will have some time for discussion during the breakout sessions. And with that, I'm going to turn it over to Indi.
Thank you, Allison, and thanks also to my fellow panelists, but also to Anna, the Care Fund, Aaron, the other funders, and friends at Family Values at Work, and all the activists today. I like to simplify things, so I'm going to try to fit my remarks into 4 key points, and I'll tell you what they are and then run through them. But they are simply: be flexible, focus on the foundation, think holistically, and look behind the scenes. And I think these key points can help us advance sound financing and strong political support. So first, be flexible. I think we all have a particular interest in a social insurance model, and I think we have to acknowledge and make the case to those who don't know as much about these issues that payroll taxes, especially those levied on workers, do seem to ensure some political resilience. I think earnings insurance programs have a particularly strong claim to wage-related financing, but wage-related financing also virtually guaranteed some exclusionary eligibility. So, for example, Social Security and Medicare do exclude some people who don't qualify. In the case of Social Security, we have SSI, Supplemental Security Income, as a backstop. In the case of Medicare, we have Medicaid as a backstop. So when we think about these programs as sort of wage insurance, there's a sense in which, of course, you pay in, you get the benefits, but there are people who have the same qualifying events and thus can't work, but aren't necessarily insuring against a loss of income, say they're entering the labor force for the first time. So keeping that in mind, I want to emphasize that I think that non-payroll taxes, including taxes, income taxes on the wealthy, and higher corporate taxes, can be part of the answer. Part of this is because care should be seen as a public good and core to social infrastructure. It's not just about insuring against risks in one's own life necessarily. Part of it is at the moment, and we can talk more about this later, we've had the last 3 Democratic candidates pledging to not raise taxes on however they define the middle class, which was $250,000 in 2008, 250,000 in 2016, and then it jumped up to 400,000 for President Biden's campaign. So that certainly makes things challenging. Fortunately, in a country with relatively low effective corporate taxation, there's no reason why corporations in particular who depend on care infrastructure shouldn't directly help finance it. And we do have examples and models for combining revenue streams, so this isn't necessarily a choice. Now, the second point, focusing on the foundation, I think is quite important. Policies can, of course, be weakened or strengthened, but path dependency can be quite strong in the United States. A great example is the federal unemployment insurance taxable wage base. It was never indexed and has been stagnant for decades. It was a poor initial sort of policy for financing the federal contributions for unemployment insurance benefits, and likely has led to some of the undermining of the overall program, partly because it's a federal state system and states tie their wage bases, taxable wage bases, to the federal. So we should think about the basic foundation laid by a financing policy, in some ways more so than some of the details. You want something that's going to be durable, resilient, and I use the word foundation intentionally because you want to build upon it. A third point is think holistically. Financing and spending alone can't tell us the whole story about equity, and in particular, regressive financing can be offset by progressive spending. And then the fourth and final point is looking behind the scenes. So there are programs that are generally progressive like Social Security, but because growing life expectancy happening behind the scenes in a sense, growing life expectancy disparities are actually undermining some of the progressivity of Social Security benefits for specific populations like Black men. So similarly, growing income disparities and growing shares of income being non-taxable have undermined Social Security's finances. So we have to think a lot about what is happening and could happen behind the scenes as well.
Thank you so much. That was a great start. And we're going to turn it over to Mark to go next.
After 2 years, you would think that I would know about the muting. It's a pleasure to be here. Thanks so much for setting the table, Indy. What I'm going to focus my brief remarks on is on the long-term services and supports financing system. Just give a little background and some thoughts about equity. Many of you may already know this. The primary payer for LTSS at the state and federal level today is the Medicaid program, which, paying for the roughly 14 million people who have LTSS needs, about 60% of whom are over age 65 and the rest under this age. If we just look at the over age 65 population, Medicaid pays about 34% of the expected costs, and families and disabled folks pay out of pocket 52%. When you look at the total pool of disabled, Medicaid pays 57% of costs. Now, during retirement, LTSS represents the largest unfunded liability facing retirees. And it's worth noting that given the distribution of this risk, where some people never have a need, a small number have a catastrophic need, and still others may need care for maybe a year or two, it's perfectly suited to risk pooling through insurance, whether it be public or private. And I'd like to say that when you look at the national data on who pays for LTSS, even the national data I just presented, view it a bit suspiciously, because the typical paradigm for assessing who pays for care is inaccurate because it excludes the value of the care associated with family caregiving. And family caregivers provide the bulk of care in the US. A number of years ago, the economic value of this unpaid help was approximately $470 billion, which was 6 times more than what was spent on home and community-based care services. More recent work that I've completed shows that 52% is really contributed by families. Now, for the public sector to play a more meaningful role in financing LTSS, there's going to have to be a commitment to move away from a Medicaid social safety net finance system toward an insurance finance system. And 2 strategies come to mind that are not mutually exclusive. The first that is already happening is that states can put forward new financing programs to support those in need of LTSS and family caregivers. And a number of states have already gone down this road. We have Ben Vegti with us today, who will talk about Washington State in one of the breakouts, which is in the process of implementing the first social insurance program. Hawaii has 2 programs in place to support family caregivers of disabled relatives as another example. California has a Medicaid buy-in program for people with disabilities who may be working but don't qualify based on financial status. Second, at the federal level, there are concrete proposals being put forward to put in place a new social insurance program. The WISH Act by Congressman Swazi. Others have put forward using Medicare as a chassis, having like a Medicare Part E or the like. In both cases, whether it's the state or the federal, there's a desire to, especially on these social insurance programs, to have the programs be universal, the financing contributory, having a limited benefit to assure affordability, and have these programs be fiscally sustainable. Now, one of the questions that we were asked to answer was, can you think about these same models across, for example, paid family leave, LTSS, and childcare? And my view is that given the nature of the risks that are being addressed and the politics involved in program sustainability, social insurance approaches make the most sense. And there's a concept that a number of us have worked on to develop that relied on a social insurance approach to address risks across the entire lifespan within a single social insurance program. This is called universal family care, and it's a policy designed to modernize our care infrastructure to meet families' changing care needs over time. It would basically, you'd pay into a single care insurance fund and everyone would benefit over time. It would cover childcare, paid leave, and LTSS. I'm sure we'll have an opportunity to talk more about that during the session. So thank you, Allison.
Thank you, and I appreciate you set a timer for yourself.
I did. I don't want to steal anybody else's time.
Okay, we're going to turn it over to SJ.
Thank you. And after Mark's example, I'm going to try to also stick to time, although I have a tendency to go long, so I'll do my best. I'm going to talk about paid family and medical leave. And just to make sure that folks are all on the same page, when we talk about paid family and medical leave, I'm going to shorten it to paid leave in this conversation. We're talking mostly about 3 categories of leave, right? So leave that's associated with a new child, whether through birth, adoption, or fostering. Family caregiving leave, where you're taking leave to provide care to a family member who's experiencing a serious illness or injury that requires, some hands-on care. And then care for a worker's own medical needs, right? Which is also sometimes referred to as temporary disability or short-term disability. And that these, especially the disability portions of this, the short-term disability portions and the caregiving portions, we're talking about pretty serious medical needs, not things that like leave that could be measured in weeks rather than days. So this is separate from something like paid sick days that could be used to, recover from the flu or get a dental appointment or something like that. Currently in the United States, there is no national paid family and medical leave program. There's actually no national guarantee for any form of paid leave whatsoever. So there's a patchwork of how this is playing out. Some workers do have access through their employers, through voluntary employer policies, but rates of coverage are really low. About 23% of workers have paid family leave through their employer, 42% have short-term disability. And those programs are either self-financed by employers or can be provided through a private market insurance product that is being purchased.
Essay, sorry to interrupt. There was just a request that came in for all of our speakers. I know there's so much information to share. They're trying to take notes, some of the participants, so if we can try to speak slowly as we can. But also we are recording today, so we're hoping to share this with everyone after the fact. So don't worry too much for all of our participants about getting every word down.
And
Thank you. Go ahead.
Also, yes, I have a tendency to talk fast, so I'll try to slow down, but also happy to share notes with folks afterwards if that's useful for follow-up. Okay, so the other thing what I really want to focus on are the state paid leave programs, right? Because that's where we have examples of how this is actually playing out. And so most of the state programs are structured as social insurance programs. There are a couple of notable examples, but primarily we're talking about a social insurance fund, usually one that is run and administered by the state. So right now there are 12 state-run programs, and I'm including DC as a state in that list, though I know it's not technically. Not all of them are currently operational. Some are still being built and will have benefits that will turn on in the future, but we have 12 examples from the states of how these can be structured. And so, like I said, these are social insurance programs that are funded through payroll taxes. And the way that those taxes works varies depending on the state. So there are 3 that are funded entirely by employees. So employees have a payroll tax that they pay, but employers pay nothing. Those are Rhode Island, California, and Connecticut. Rhode Island and California have had longstanding disability programs going back to the 1940s. They added family leave in the 2000s. Connecticut is a pretty recent program that just turned on benefits recently, but those are 100% funded by workers. The majority, though, are an employee-employer split. The other notable example here is DC. DC has a unique taxation situation because it is not a state. So in DC, it is employer only funded. And DC is the only place where employers pay the totality of that insurance premium. But in the other 8 programs, it's a split between workers and employers to fund that payroll tax. And in most of those places, it's capped at a certain amount. It's only up to a certain threshold of earnings are taxed. And the portion that's paid by employers and employees can differ across states, but there is kind of this co-investment from both sources paying for those programs. So I think a couple things that are interesting to think about, obviously that split investment is the most common format for the state programs. But I will note also that if you talk to most economists, they will say that even when employers are paying that tax, ultimately it comes out of employees' wages. So I think, there's a discussion to be had about whether that's something to fight for in these programs, or whether the employee only funding model, if there really is ultimately a difference in terms of people's take home pay, depending on who's funding that portion of the payroll tax. I know I'm hitting time here, so I'm going to stop, but I have a lot more detail about the structure and the taxation of these programs that I'd be more than happy to share with folks afterwards if they're interested in digging into the weeds with me.
Thank you. And I'm going to turn it over to Marika.
Yes, and the benefit of going last, if you could just say ditto, 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 ditto. And I'm only going to add 2 additional points, and I'm going to shift a bit and actually focus on the mental models and mindset shifts that are sort of needed for us to increase public funding for caregiving. And as an early childhood educator, I'm going to focus specifically on childcare. I think there are lots of mental models holding this problem in place, right? I mean, I'm a fan of the systems change construct such as the policies, the financings, the resource flows we see are actually held in place because we have these implicit and some semi-explicit mental models. So if we just go beneath the iceberg a little bit, as we make the case to increase public funding, I think we're gonna have to just unpack some of these mental models. One of which is acknowledging and reinforcing this notion that we as a nation can actually afford it. I think we often assume that everyone sort of gets that, including the families that are most impacted by the burden of the current system. They see the dollar signs, or they make assumptions that we'll never be able to afford this robust and equitable caregiving infrastructure. And so therefore they just sort of plow along and are frankly optimistic about change even happening. So I think we just have to first just make time and room to just do some healing and acknowledge and reinforce this notion that we can afford a robust, equitable caregiving infrastructure. The other piece to highlight as we sort of think about the mental models holding this problem in place is being able to center family choice and highlight the options that families need and want. There are no hierarchy among their choices. Families often need a range of caregiving solutions, and therefore our strategies and funding streams have to be diverse. For example, the paid family leave approach is better suited for the families who want to be the primary caregivers, whereas a universal childcare approach is better suited for families who want support from a community member or an industry recognized early childhood educator. Something like a universal caregiver stipend approach seems better suited for families who want another family member to provide the support, the caregiving support. And something that's like a universal family allowance, of course, offers the most flexibility, and families will pretty much want a combination of above. So I think the only two pieces I'll highlight is just elevating some of those invisible, implicit mental models that are holding this problem in place and creating the financing conditions we see, which again are about just acknowledging that we can afford it, that we don't have to function the way we're currently functioning. We can afford to make the case for increased public dollars, and that we need to lean into the complexity. Families need a wide array of choices, and as such, the financing strategies have to be as diverse.
Thank you so much, everyone. If tech folks don't mind putting all of the panelists on the screen, and I would like all of our participants, if you have questions, clarifying questions about what our panelists just shared, please put them in the chat. In the meantime, we're going to move forward to a discussion. The first question I have, because this was so much information, so much amazing information, and as we're thinking about all of these options across the care economy, the first question is thinking about equity specifically. When we think about equity, we think about access to services, inclusion, impact on wealth and economic security, and more. How do some of the financing mechanisms for care exacerbate inequities in race, economics, gender, disability? And how do some promote equity? I know it's a big question, but does anyone want to start? Otherwise okay, Mark volunteered, and then we can go around the group.
Sure, I think Indy made a very good point that we don't often think about, which is that at least in answering the equity question, we have to think about both sides of the ledger, how a program is being paid and how benefits are being distributed. So, for example, I believe in one of the state programs in Washington State right now, it's a straight Social Security tax, okay, that is paying for the LTSS insurance program. And we know that there are two issues with that actually work against equity. One is that the wages typically tend to be capped. In other words, the tax is assessed over a capped wage. And two, it's a focus exclusively on labor and not capital. And an increasing share of savings and wealth in this country is on capital. So one could imagine, in thinking about a financing program, setting it up so that it captures that. And I'll give one concrete example. One concrete example would be the Medicare tax. The ACA changed the Medicare tax so that it no longer has the cap on wages, and over a certain amount, assets our asset income is taxed. So it makes the financing of it a little bit more progressive. So I just wanted to give, and in such an example, you address this issue and you can make it. The other advantage of that, which people don't think about a lot, is when you do that, you broaden the tax base essentially. And by broadening the tax base, that allows you to reduce the actual tax rate, which has advantages for low income workers. So I'll leave it at that. And I see Indy wants to add some points.
Yes, go ahead, Indy, and then we'll have SJ, and then Marika can add anything she wants to add to.
Great, thanks, Allison. Agree with what Mark just said. I would add that we should think about workers who are not classified as employees, whether properly or improperly, and keep in mind that Social Security can help you sort of reconcile at the end of the year so you're not overpaying taxes, but unemployment insurance for every job, the first X dollars of wages are taxed. So we have the worst of all worlds there, where some of the lowest paid workers in some of the most erratic positions in the labor market may be paying the greatest unemployment insurance taxes and have the least access to the benefits if they're in low paid jobs. So that's not just about being misclassified. They can be in just low paid jobs and moving between them. So that's another thing to think about when we think about equity in financing.
And that's it.
Yeah, to piggyback off Indy's point, you know, in the context of thinking about paid leave in the States, when we're only taxing workers who have that formal employment arrangement. So if you are someone who is considered self-employed, which could be everybody from, you know, a highly paid consultant to a gig worker who's barely scraping by, you're out of the system entirely. Some states do have the ability for self-employed folks to opt in, but when in places where there is that employer-employee split, people who are considered to be self-employed have to pay both portions of the tax themselves. So it ends up with a system where a gig worker who might not be earning very much is responsible for a higher contribution relative to their earnings than someone who's in a formal employment arrangement would be. And so, you know, in some instances, this may not be a huge problem, but when we're talking about low paid workers, this is obviously can be quite problematic. I mean, the other thing I will note is that while we have in the state programs, there's often a cap, again, on how much of your earnings are actually taxed. There isn't necessarily an exemption at the low end of the scale. So one of the proposals that has been out there would be, rather than capping the amount of earnings that are taxed, allowing an exemption for the first X number of dollars in earnings to not be taxed in order to alleviate some of that tax burden on lower income workers. Yeah, I'll leave it there.
Thank you. And Marika, you had shared about the different approaches that are needed to meet all of the needs of the different families. I would love to hear if you had anything else you want to add on this topic.
Yeah, I mean, I'll zoom in a bit on childcare workers, especially being in DC where we just launched the Pay Equity Fund. Childcare policies are often fragmented. And we often create sort of false hierarchies. And as a result, childcare workers are also functioning in this fragmented system, and we compensate them using the false hierarchies. And I think what we saw in DC is sort of this universal approach to supporting childcare workers. The compensation that was allocated by the DC Council for Early Childhood Educators completely dismantle the hierarchy between early educators or childcare workers who work in home-based programs versus those who work in licensed centers. And so I think the more we shift to sort of more universal solutions, certainly sharpening our equity lens as we do so, I think it increases the chances of us having some more equitable outcomes.
So what I'm hearing is how we structure our financing systems impacts access to services, impacts the workforce, impacts equity and and supports for those surrounding those who might need care services as well. I'm going to move on to the next question. So hopefully we'll have a couple minutes at the end for any Q&A. Please, folks, if you have any questions, put them in the chat. And I'm going to have Marika answer this one first this time. With respect to financing models, what opportunities do you see for cross-movement learning and partnering within the care sector? Obviously, right now, the funding streams are very siloed. But what learnings, even just among what you've shared today, do you see?
Yeah, I think, I can speak specifically about childcare. I think the shift we have to make, I think right now we fund childcare as an intervention for some. It's an intervention for those families, those income eligible families. It's a intervention for those family in poverty. It's a poverty reduction strategy. And I think that approach creates even more silos. It pathologizes families. It makes the sort of universal approach to financing childcare a little bit more problematic. I think, as I stated before, any solutions that gets us more to sort of universal with a focus on equity, universal with targeted supports for certain families and communities that need them, it seems to be the more effective approach versus funding caregiving as if it's an intervention for only a small subset of families, which have been proven to be inequitable by itself and sort of pathologizes families, makes sort of society as a whole pull back and say, that's not my responsibility, that's their responsibility. If we need a shift to sort of a public good, we have to sort of just start making universal messages a little bit more visible than the targeted intervention messages and approaches.
I'm going to go in reverse order. So I'm going to go to SJ next.
Sorry, I just got distracted by a really interesting comment in the chat. Yeah, no, I think it's an interesting question, right? How much should we be thinking of these as separate programs that require really different ways of funding, different ways of determining eligibility, different pools of folks who might be covered by them versus, having something that looks more universal? I think the other piece that I've kind of been grappling with is, how do we ensure that we are being efficient and building off of best practices that already exist? How can we be building efficiently off systems that already exist versus how much do we want to bake ourselves into path dependency that might be hard to break out of in the future? And, I don't have great answers to any of those questions yet. I wish that I did. But I've been thinking a lot too about how we set up these programs, how they are financed and how they are administered and how they're structured are so tightly interlaced, right? That in some ways it's hard for me to think about the question of financing without also thinking about all of the nitty-gritty details about how you're going to actually administer any of these benefits moving forward. And so I think that the context of the pandemic and the upheaval that we've seen has showed how the administration of certain benefits and the systems that we had in place weren't necessarily adaptable to an abrupt economic shock and an abrupt change. And so how can we be thinking about these systems in ways that are efficient, based on best practices, based on what we've done in the past, but also are going to allow us the sort of flexibility for the unpredictability of the future? And again, I don't have answers to any of these things. These are just like sort of the big picture questions that are floating around in the back of my mind as I'm trying to put together like what the best steps are moving forward. So I feel like I just asked more questions of the group than actually given an answer here, but hopefully that, I'm hoping that's sparking some thought for the conversations we're going to have in the breakouts as well.
Yeah, sometimes good questions are what you need to start figuring out what the answers are. Indy, go ahead.
Thanks, Allison. First, I agree with SJ on the connection between the financing and the spending. And for some folks who heard me speak yesterday at another event, this might be a repeat, but listening to Marika, I was thinking about these three S's that I identified, as we design social programs. And they are, I think, particularly related to care and might help us think differently at times about different approaches. Marika actually mentioned potentially different approaches for helping people meet their own family's care needs, but they are to avoid segregating. I think that's really important, especially when we think about childcare. The way that we finance the program can affect even the way that people then access the program. And do we want it to be an opportunity for communities to come together and have shared experiences, or do we want to segregate and separate off different groups of families and kids? The second one was don't stigmatize, and it's obviously related, but I think quite important. One of the striking things about the ostensibly universal unemployment insurance program, although it's far from universal and really has never been, is that it is heavily stigmatized actually most of the time. I think we have, about 3 months in the pandemic when it wasn't, and that was it. And it became heavily stigmatized. And sort of related to that is don't saddle people with burdens, administrative burdens, bureaucracy. And we do a lot of that in all sorts of programs. And people moving in and out of eligibility. So you don't want these really low income cutoffs. I don't have a problem with saying like the top 5% of households don't get the child tax credit, but you don't want people who have volatile incomes and are low, moderate, even middle income losing eligibility. So all of this argues for somewhat more expansive programs, policies, and approaches that can align with, I think, the messaging we're talking about. To actually get to Allison's original question, I think there's something to learn across these silos, but also there are important differences, especially if we want to give people freedom and choice and options. And the thing I would add to that, which I think was an important point, again, that Marika mentioned earlier, is we need to give people choices in the sense of actually overlapping eligibility. So when people talk about holes in our safety net, a term I hate, but they talk about holes. Well, how do you get rid of holes? You're not going to build something perfectly seamless. You need overlap. So you need people to face a care need and have more than one option. In the past, folks mentioned people with disabilities, and we've really struggled with this really thoughtless and unhelpful argument from some folks on the far right that how could you be eligible for disability benefits and unemployment insurance? When of course they're the same people are trying to get folks who might access disability benefits to risk working in the labor market. So of course you should be eligible potentially for both, right? And we need to think about making sure that people have real choices. And related to that, on the disability, when these chats get going, so do our brains, but we should think about what qualifies other than work. And if there's a benefit that you can qualify for that may not be as generous, but isn't tied to work. Again, SSI to Social Security, as Medicaid can be to Medicare for elderly. And you could imagine care education qualifying. Should someone who goes through and gets a higher education degree not be eligible right afterwards for paid leave when somebody worked and they are eligible? I mean, that's the default situation now, but it's not obvious to me that's where we want to be.
Thank you. And Mark, I'll give you a couple moments. In the meantime, if anyone we have maybe time for 1 or 2 questions, but we also will have time in the breakout groups to get into more questions and more specifics. So please put them in the chat. Go ahead, Mark. Thanks very much. I'll be brief. I very much agree with what has been said before me. And I also feel like I need to take a step back, because when we talk about these risks, we're almost talking about them as if they're aberrations from the norm. What happens when you need childcare or LTSS or what have you. And the fact is, these are quite normal life events that by and large happen to the vast majority of people at various times throughout their lifetime. This brings me back to the idea that I spoke about briefly in my remarks about the need for maybe a more universal approach, that you say, okay, what are these major risks that I'm facing throughout my lifetime? Is there a way that I can pay into an insurance fund or be assessed a fee
that cover these risks over time. And it does a couple of things. First of all, it normalizes, it takes away, I believe, some of the stigma. The fact that it's universal and everyone is going to get benefits from at least one of those, or almost everyone, at least one of those programs, so that the issue of political support and viability, I think, can't be underestimated. A lot of times what happens, especially among advocacy groups, I've seen this in my own field, which is focused on LTSS, is, you have disability advocates going up against advocates for the elderly, because not all of the eligibility criteria make sense. There are different objectives that are being maximized. And I think that happens a lot when you see that there's this pie and it's like whack-a-mole. If I get something, somebody else is going to lose something. The idea of thinking more universally over the lifespan, I find that conceptually appealing. And this is coming from somebody who views himself as a flaming pragmatist. Like, I'm most concerned about how do you get things done. So the idea of trying to tackle all three of these at once, on the one hand, seems a little bit crazy for someone like me. On the other hand, it makes a lot of sense in terms of efficiency, administration, easing the burden on a family, having a single entry point once you pay into this care fund. So a little bit different way of thinking about it, and it doesn't negate anything else that has been set up until this point.
Thank you. And that was actually the perfect note to wrap up this panel on. Thank you for all four of you. This was really great. And I think it gave me a lot to think about and a lot of pieces that I want to dig deeper into. For everyone who has joined today, we're going to take a 3-minute break. We're going to come back. We have a question that you can keep in mind as we go on to break. Are there any big questions or reflections that you have that this panel brought up for you? And then we're going to go into the breakout rooms where we have experts who have been really involved in local or state level initiatives, these movement leaders or implementation leaders. There will also be someone from the panel in each breakout room, and we'll have an opportunity to really have more of a discussion. You won't only have to listen to other people talk, we want to hear your thoughts and questions as well.
Welcome back. We had such an incredible discussion in our group, and I trust that you all did in the other groups as well. We're so glad, I'm so glad we had this opportunity for in-depth conversation with people from such different but similar perspectives. We actually found so many similarities between an early childhood campaign in New Mexico and a long-term care campaign in Washington State. So that was really quite incredible. So as we wrap today, we would like you guys to take just 2 minutes, think for a few minutes, and then please write in the chat, what have you heard today that you think translates into your foundation's work that you can use in your work when you go back to your back home, even though we are all home? Sounds funny to say that. What will you be bringing back with you that you can use? You can put that in the chat. We can afford a care structure for all. Long-term relationship and power building is key. Yes, that was very clear in our group too. The need for the mental changes paradigm shifts. Organizing is essential. I found the will and motivation to keep the momentum going on care. We have more allies than we think. Ballot initiatives are a way to circumvent political barriers. We are all going to need care, so let's stop making it a specialized, separated, overburdened program. The importance of using shared language and working across the care spectrum. Ooh, I like this one, Miles. It takes a prismatic approach to care. All right, I'm going to use that. Love it. Okay, well, thank you. Thank you so much for these great comments. So we are, again, so glad we've had this opportunity to share ideas and insights and examples from the field with all of you. Just to close, feel free to either raise your hand or put a word or two in the chat about how you are feeling about this work moving forward. Thank you. Great. Excited, energized, encouraged, motivated, curious, ready, energized, hopeful, uplifting, jazzed. These are all great words to hear, especially in this time with everything we are living through. And I have to say that it's quite something. It is a tribute to all of our panelists, to our resource people for the small groups, to our amazing consultants, Julie and Allison, that we have spent the last 2 hours talking about financing, and people are coming out jazzed. So with that, I think that's also a great way to end, since we started with beautiful jazz music. So thank you, everyone. And we will be in touch with more. Thank you so much, and have a great afternoon.